Sachin, 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 Sachin. Master Blaster loves the straight drive of his willow. He says straight drive is opening up the face of the bat. And no bowler likes to see the face of the bat. Sachin Tendulkar, the god of cricket. It's 24th April, his birthday. It's 24th April, the National Oral Medicine and Radiology Day. Friends, on this occasion, we bring to you opinion, ideas of experienced clinicians towards this branch.
I love oral medicine. That's quite natural. I'm an oral physician. But that was not always the case. I got into oral medicine and radiology MDS quite by accident. I realized that this subject was complex, that no one specialist is in a position to get mastery over it. The specialty of oral medicine is very interesting because you feel like an expert detective solving those cases that others cannot. It requires an ability to put your patient at ease and get details of their history. Have a keen eye to get those details which others have failed to see, and a sharp intellect that can put and piece together all this information so that you come to a diagnosis and you're in a position to offer a solution. This specialty is also difficult because even the common cases that are there are quite rare, and so to obtain mastery in this specialty is really difficult. I am really proud that this specialty of oral medicine covers so many aspects of general medicine as well as dentistry, making me feel like a complete doctor. This day, which is the National Oral Medicine and Radiology Day in India, I exhort young oral physicians to take this specialty and practice it in private practice, because that is where you will be really tested, and that is where you will get maximum satisfaction and success. As you keep doing it, you will bring glory to yourself and glory to the branch. Thank you so much.
Hello, warm wishes to all of you on the National Oral Medicine and Radiology Day. I am Dr. Ajay Naik, Chief Maxillofacial Radiologist at Insight CBCT, India's first exclusive 3D maxillofacial imaging center. I'm here to talk about my experience as a maxillofacial radiologist in the field of clinical dentistry. Over the past decade or so, clinical maxillofacial radiology has grown by leaps and bounds, and maxillofacial radiology now provides support to a host of specialists such as implantologists, oral and maxillofacial surgeons, prosthodontists, endodontists, orthodontists, etc. And all this supportive role helps us bring to the table the value of a maxillofacial radiologist. We have now established base for the students of our specialty to take it further on from here on, and I hope that the students do take it to greater heights. The maxillofacial radiology is the subpart of our branch which has had the advantage of technological advances, and it will only grow on from here on. So that's why it's very imperative to stay in touch and be updated. I wish all of you a very good day. Thank you.
After I came to practice, then I really started thinking in a different pattern. All whatever I had done sitting on the back benches, I started reflecting on me, started falling on me. Because patients, they used to come with some of the other problems, and then it was difficult for me to fix the differential diagnosis and arrive at one particular diagnosis. Then we thought that this branch is worth giving some importance to. And now it's very different. The radiology has changed like anything. Or it changed from the films to now radiologists, or computerized tomography, etc. You just can't take immediately. It has become the part and parcel of your everyday dentistry. But radiology is okay, that still we can digest. Oral medicine is still difficult. It's still difficult. If it is within my purview, then actually I will do it. But still I would like to take an opinion of one of the OMDR person.
Hi. OMDR has been one of the most underrated fields in dentistry, but with changing time, in today's world where lifestyle disorders have increased to such a great extent, we routinely see cases of red and white lesions, orofacial and TMJ pains, and that's when we need our OMDR consultants coming in to help us. I would like to say thank you for Dr. Ambika for helping us with our patients who are suffering from these diseases, and making our team complete and giving the best quality care treatment to our patients. Thank you.
Hello, wishing all oral physicians and maxillofacial radiologists a very happy and a prosperous National Oral Medicine and Radiologist Day on 24th of April 2022. I'm Dr. Piyush Mehta here at a dental implant center, Goregaon West, and I have been practicing say around 35 years, and I am still enjoying the dentistry, be it a class 2 or a dental implant also. We have variety of patients, but when a patient walks in with say burning sensation or a locked jaw or an ulcer or a severe excruciating pain, these cases are really baffling and I am perplexed as what to do. Even they have the fear of cancer also, which should be allayed either by me or a consultant. At that time, Freni walks in as a consultant, as MDS, oral radiology and medicine, and she solves all the problems. As she says that not all white patches are leukoplakia or all lockjaw conditions are related to TMJ. And she has proven herself well, and all the patients are grateful to her. Even in radiology department, when there are difficult x-rays to read, I send her the pictures and definitely she barrages me with all the pictures, all the questions related to clinical condition. And when she presents the differential diagnosis, I'm surprised, and that definitely helps in my practice. I'm happy and proud to say that she is my classmate. And finally, I wish all the oral radiologists and medicines people work very hard, wish them all the best and hope their weight is worth in gold. Thank you.
Good morning, friends. To begin with, wishing all of you a very happy Oral Medicine Radiology Day. I've been teaching this subject for the last 23 years, and I have been into private practice for those many years. I would like to say that the knowledge of the subject of oral medicine and radiology has helped me in my clinical practice immensely, and I always considered oral medicine as the mother of dentistry and oral radiology as the father of dentistry, because without these two, practicing dentistry is an almost impossible. And though this was never a postgraduate subject of my choice, but as I dwelled deeper and deeper into the nuances of the subject, I really found that this subject needs its due importance right in the undergraduate and also in the postgraduate curriculum of dentistry. And all the best. Let's strive together to make this subject one of the most sought after subject in dentistry, and wish you all a very great future. Thank you so much.
Hi, my name is Dr. Sanjay Malia, and I'm Chair of Oral and Maxillofacial Radiology at the UCLA School of Dentistry in Los Angeles, California. I completed my BDS and MDS from the Nair Hospital Dental College in Mumbai, and subsequently did my training in Oral and Maxillofacial Radiology at the University of Connecticut. I would like to discuss the one aspect of the specialty that is crucial to its continued existence, and that is an OMR's involvement in clinical care. Through my practice at the UCLA Dental Radiology Clinic, I provide expertise to general and specialty dentists. The largest part of this practice is consultative radiology. For this, I provide radiology reports, mostly on CT scans, with the diagnostic tasks ranging from opining on pathology, evaluating growth and development, endodontic diagnosis, implant treatment planning, and much more. The cases are referred to me both from within UCLA as well as from private practices across the United States. I find my role as a consultant appealing. I opine not only on the immediate issues at hand, but also provide guidance on the overall management of the patient. This requires me to integrate my knowledge in anatomy, pathology, radiology, and medicine, and most importantly, to put together my report in the context of an individual patient's treatment needs. The spectrum of challenging cases that I encounter keeps me stimulated and keeps me involved in this growing field. Sometimes I'll receive a phone call from a referral thanking me for the direction on a complex case. That interaction is very gratifying, and it puts a perspective on the contribution of OMR in general to the profession and to the patient.
Hello everyone, myself Dr. Ambika Arora Tiwari. I've done my MDS in Oral Medicine and Maxillofacial Radiology. I work exclusively as an oral physician in clinics across Mumbai. Talking about my field, I'm sure you must have heard about this saying that eyes cannot see what the mind does not know. Well, this holds very true when it comes to our field. You'll be amazed to know that there are many systemic conditions which first show in the oral cavity, thereby making your oral physician as the first person to diagnose even your systemic diseases. Not only this, autoimmune diseases, and apart from that, as deadly disease as oral cancer can first be diagnosed by an oral physician. He not only will help you in diagnosing the oral cancer, but also the pre-malignancies which further develop into oral cancer. So looking forward for the support of all, and you may well consider that along with the family dentist or family physician, you can now look forward to have a family oral physician.
Hello everyone, this is Dr. Gauran Shah. We have a busy 8 chairs practice at Bandra West in Mumbai, and it's a busy practice. We call ourselves one-stop dental clinic. It's happened so often to us, that we have tried all our knowledge and all our skills and experience, but we have failed to reach diagnosis. Shooting in the dark all the time, and could not reach that. We could not help so many patients. A lot of mysteries. Finally, we came across Dr. Frenny Kajodkar. She helped me diagnose so many mysteries, so many critical cases were solved because of her expertise. It really helped us. We started calling her and her, peers, and it has helped my practice so much, because so many times we are just shooting in the dark, nothing's happening, patients are suffering, diagnosis is not reached, of course, treatment also has not started, the right treatment has not started. Dr. Frenny and her diagnosis and friends have really helped us. My practice has grown, my patients are happier, and I really urge all my fellow doctors, all my fellow dentists, general practitioners to get the oral diagnostic experts. It really helps. Okay, your practice will grow, your patients will have more confidence, the right treatment happens, and so much satisfaction you get. So, warm regards to all of you. Please do what we have been doing very well, and we have been really doing it successfully. And a special thank you to Dr. Frenny also. Dr. Frenny Kajodkar, thank you so much.
So OMDR also always, I think it's the basics where the dentistry begins. Unless and until you diagnose in the modern medicine, the treatment cannot begin. So diagnosis is the key for any kind of procedures to be started. So I suppose that explains the importance of oral medicine, and radiology is, of course, is an adjunct in anything that we would be diagnosing, and that will always help us conclude our diagnosis, or it will help us come to a very, very specific diagnosis, and then we can go into the treatment modalities. Well, it was important, it is important, and it will always remain important, because that's the basis of any modern science, and that's the diagnosis. So this particular branch deals with the diagnosis of any kind of illnesses or oral illnesses that we are all focused on. So it will always remain important.
Hello everyone. Warm greetings to all of you on the occasion of Oral Medicine and Radiology Day. I'm Dr. Varun Kunte, founder and CEO of Arthros Craniofacial Pain and TMJ Center in Mumbai. I believe as an oral medicine and radiology doctor, we are well trained and well positioned to treat these complex cases. This field has a lot of untapped potentials for all of my fellow colleagues to follow. I believe if all of us start working and exploring temporomandibular joint treatments, together we will be able to achieve a lot more. By treating these complex cases successfully, we will be able to achieve something that our colleagues can only dream of. That is to get somebody out of pain. This is what we are meant to be. I believe this can be the future of our branch, and this can be a great value addition to our profession. I encourage all of you to explore treatments in TMJ disorders, sleep apnea and craniofacial pain at your own ends. I believe together we can achieve a lot more and we can become the doctors that we are meant to be. Thank you everyone.
Hello everyone. Warm regards to all the oral medicine and radiology specialists. I am Dr. Avinash Shah, currently working as a professor and PG teacher at Vasantdada Patil Dental College and Hospital, Sangli. Oral medicine has a vast scope. You can see on the screen. You can use all this scope into your practice, or you can use any of this scope into your clinical practice. Here I selected TMJ and orofacial pain as one of the scope into my clinical practice. I have my own exclusive TMJ center where I treat the patient for TMJ. I have developed my skill into occlusal screen therapy, diagnosis of TMJ and the DTR, and the excellent result from the patient motivated me further. So oral medicine is a truly clinical brand.
So friends, we leave you with a message. Keep your leg inside the crease, guard your stumps with wisdom, and play the best shots of your willow. Cause it's not only 22 yards, but the entire stadium is yours. Do subscribe our channel and watch this space for promotion of oral medicine and radiology.